Comprehensive Guide to Pituitary Drugs. Hi everyone, back to Nursing and Me. Today we're diving into the fascinating world of pituitary drugs. These medications play a crucial role in managing conditions related to hormonal imbalances. We'll go over how they work, their uses, what we need to note, some considerations, and potential adverse effects. Let's get started. Vasopressin is also known as antidiuretic hormone. Its main role is to increase water retention by acting on the kidneys, and it also causes vasoconstriction to raise blood pressure. Vasopressin is commonly used for diabetes insipidus, vasodilatory shock, and gastrointestinal hemorrhage. Considerations: be cautious with patients who have heart failure or cardiovascular disease. Monitor blood pressure, heart rate, and electrolyte levels. Daily weights and urine osmolality checks are also important. Adverse effects: it may cause increased blood pressure, bradycardia, nausea, vomiting, and tremors. Watch for signs of nasal congestion and uterine cramping as well. Desmopressin is a synthetic version of ADH. It helps the kidneys retain water and also boosts clotting factors, making it ideal for conditions like diabetes insipidus, bedwetting, and certain bleeding disorders. Considerations: monitor urine output and electrolytes, especially sodium. Be cautious with fluid overload or cardiovascular conditions. Nasal irritation can occur with the spray, so assess for that. Adverse effects. Common adverse effects include headache, fatigue, mild nausea, and nasal congestion. Rarely it may cause increased blood pressure or uterine cramping. Somatropin is a synthetic growth hormone that promotes growth and energy production. It's often prescribed for growth hormone deficiencies, Turner syndrome, and muscle wasting in HIV/AIDS. Considerations: monitor growth velocity, thyroid function, and blood glucose levels. Educate patients to rotate injection sites to avoid skin issues. Adverse effects: it may cause joint pain, hyperglycemia, and fluid retention. Rarely it can lead to intracranial hypertension in children. Octreotide, which mimics somatostatin to inhibit growth hormone and other hormones, it's commonly used for acromegaly and hormone-secreting tumors. Considerations: monitor blood glucose, thyroid function, and for gallbladder issues. Patients should report abdominal pain or yellowing of the skin immediately. Adverse effects. Common adverse effects include nausea, diarrhea, and gallstones. It may also cause blood sugar abnormalities. Cabergoline is a dopamine agonist that reduces prolactin levels. It's typically used for hyperprolactinemia and prolactin-secreting tumors. Considerations: monitor prolactin levels and blood pressure, as this drug can cause orthostatic hypotension. Educate patients to avoid alcohol and activities requiring alertness until they know how the drug affects them. Adverse effects: dizziness, nausea, and fatigue are common. Rarely it may lead to cardiac fibrosis or hallucinations. Cosyntropin mimics ACTH to stimulate cortisol production. It's primarily used to diagnose adrenal insufficiency or assess adrenal function. Considerations: monitor cortisol levels, blood pressure, and electrolyte balance. Educate patients about regular lab tests to track their progress. Adverse effects: it can cause fluid retention, hypertension, and hypokalemia. Be cautious with fungal infections or ACTH sensitivity. Lastly, number 7, lanreotide is a long-acting somatostatin analog that inhibits growth hormone and GI hormones. It's commonly used for acromegaly and hormone-secreting tumors. Considerations: monitor blood glucose, thyroid function, and for gastrointestinal adverse effects like diarrhea or abdominal pain. Gallbladder ultrasound may also be needed for long-term use. Adverse effects: diarrhea, abdominal pain, and gallstones are common. Hyperglycemia may also occur. That wraps up our comprehensive guide to pituitary drugs. These medications are powerful tools in managing hormonal imbalances, but they require careful monitoring and patient education. Thank you for watching. Don't forget to like, comment, and subscribe to Nursing and Me for more educational content. See you in the next video.